in what certain instances would kind of be deemed emergency type situations where a patient has to be seen by someone like you, and it can't wait? What are some of those situations?
So in patients that have had surgery, obviously a few days after surgery, there's a risk of a bleed that may not have been discovered. So if that, that's something that a patient would know. There'd be extreme swelling or extreme bruising, and they should be in contact with their surgeon, and that would be an emergency. Also in that time frame, and maybe even further out, could be even months out from surgery, an infection could arise, and then the usual indicators would be fevers, chills, redness and swelling in the surgical area, just general not feeling well. I would say the first phone call, it should be a phone call rather than show up in your doctor's office, and they can triage you to say, where you should go. And that could be treated just with antibiotics, but it might be something that would require a trip to the operating room. And then the hospitals would be, understanding and just have everything prepared to manage a patient that's not a COVID patient. And they still have ORs that are available for other kinds of emergencies. I'd say with the breast reconstruction, those are probably the two most common things that longer term should be considered emergencies. I can't think of many others other than, say, someone that had been recently diagnosed or has a tumor that's growing that also becomes infected, and that's something that may require emergent surgery. It may not require emergent plastic surgery, but it may require emergent oncological surgical intervention. But I would say that those cases are fairly few and far between, and it's rare for something like that to just occur overnight. That's typically a long process that may have been neglected over months. So you could probably wait a little bit even longer than that. In general surgery, in neurosurgery, in urology, there are all kinds of other emergencies, but that's like way beyond what I can talk about comfortably.
Okay, so we've been talking about the surgery, and when things are hopefully back to normal, you'll start to see more appointments, more scheduling. Is there concerns, and should patients be concerned maybe about kind of an overburden, or will there be things put in place that patients shouldn't have to really worry about that?
I would say trust your regional health system to triage the cases in a responsible fashion. It's going to be a combination of administrators, but also professional, medical staff that, in consultation with the doctors that are managing the specific cases, will come to an understanding. And I'm sure there's going to be extensive planning and just dealing with things on a priority basis. So, and just so people know, in general, the way most hospitals work is that certain surgeons have block time, so they're allotted a certain amount of hours per week or per month to operate at their surgical center or hospital. And they have to share that with other physicians, other surgeons, in a whole host of professions. So, and each location has somebody that is in charge of coordinating that. If those blocks aren't filled, if the surgeon is out of town or not operating, then things could open up, and that's how openings occur. And you can put cases in that sort of last minute or on top of your regular schedule. Now, my practice, all of us 5 surgeons operate out of somewhere between half a dozen and a dozen hospitals or surgical centers. So we have leeway in order to be able to operate at different sites for that precise reason. So we can care for patients and coordinate surgeries with other surgeons and just have that flexibility to operate at different sites. So, we have that option kind of built into our system. I know there are people that operate maybe only out of 1 or 2 sites that could be trickier. So it's going to be an interesting logistical puzzle to manage. But you know, in this day and age, we kind of have to do what's good for all of us, and we see what happens when we do and when we don't. So this is just an extension of what I think the world is experiencing.